And as I take to my feet, I would like to put on record and wish my constituency colleague Deborah Erskine and her husband all the very best as they prepare to welcome their new arrival in the coming weeks, and obviously would like to welcome the members of the Acute Services as they join us here this evening. Cancollier, when emergency general surgery was first suspended in December 2022, the Western Trust highlighted that it was a temporary suspension. However, in the months and years that has since followed, the actions of the Trust, or lack of action in some cases, has given a very different impression. The recruitment of surgical consultants on quote trust-wide contracts indicated the suspension was being viewed as anything but temporary. Since then, the Western Trust has shattered public trust, ignored repeated calls for increased community engagement, and failed to develop a roadmap. They failed to develop a roadmap or any clear vision in relation to the reinstatement of emergency general surgery. That in itself is an indictment of how this issue has been mismanaged to date. We recently, of course, had the extraordinary and deeply troubling situation when the Health Minister had to ask the Western Trust to pause the consultation due to ongoing concerns regarding the credibility of the actual process itself. An intervention from the Minister which I want to welcome and have welcomed. My Sinn Féin colleagues and I have been consistently making the case from day one that there is a fundamental difference between service transformation and service collapse. True transformation must be rooted in partnership, in co-design, and in a clear roadmap and vision for services. What has occurred to date does not resemble transformation at all, but in fact a hollowing out of services that have left patients, families and frontline staff in limbo. Rural patients, of course, are entitled to the same level of care as those available anywhere else on this island. Yet today, we now have patients in Fermanagh facing over a 2-hour drive to Alpnagelvin to access emergency general surgery. Les Cancollier, this is not equitable, it's not safe, and it falls short of the principle of healthcare parity. If we are talking about genuine healthcare transformation, as many of us have done in this chamber over recent years and recent months, then we need to be ambitious. And that means looking at services on an island-wide basis, where services are planned, funded and delivered on the basis of patient need. We've already seen how resources can be shared on a cross-border basis to the benefit of all patients, such as cardiac services in Derry and cancer care in Dublin. Expanding this cooperation will help ensure that rural communities in Fermanagh and Tyrone are not left behind, but instead they benefit from the full-scale capacity of an all-island health system. SWA has incredible potential. Its geographical location places it in a position to be able to treat patients right across the northwest region of Ireland. Fully commissioning unused theatre space and additional bed capacity needs to be and should be explored. Les Cancollier, our community has invested in SWA. The people of Fermanagh campaign for it, they cherish it, and they depend on it. RQIA, as well as constituents, have rightly highlighted outstanding issues with patient pathway, double ED waits and delayed transfers. There are a raft of outstanding issues that still have to be addressed. The recent pause that the Trust has taken must focus minds. For far too long, a haphazard approach has taken place by the Trust, and it's past time for the voices of frontline staff, patients and the community are listened to and respected by the Trust. Past time that confidence is rebuilt, and past time that services are restored. Áine Murphy.
Áine, sorry, I call